Hi, this is Mary Paillé from the Beausoleil Family Health Centre in Chimnissing, and I have with me Dr. Colin Lee, who's the Associate Medical Officer of Health from the Health Unit, and he's going to be talking to us and answering some questions that typically come up about the COVID-19 vaccine that we're going to be getting this weekend. So thank you, Dr. Lee, for joining me, and I'm just excited to have you here with us.
Thank you. It's a great pleasure to be here. We're very excited about bringing the vaccine over. It's been a very long haul for everyone. It's been over a year now, and we're really looking forward to this very effective vaccine slowing down and hoping to end the pandemic very, very soon.
Yes, we certainly all want to get back to our normal lives or something resembling normal life. So this is wonderful. So let's get right to it. Tell me why I should get this vaccine. They say that most people recover from COVID-19 on their own. So what risk really am I running to my own health?
So even though it is true that most people will recover from COVID-19 on their own, unfortunately, there's still a number of people who will get ill enough that they end up needing hospital care. And unfortunately, some will potentially die from the illness. We know that the older you are, and if you have medical conditions, the higher chance that COVID-19 will affect you more severely. However, this is the kicker. Unfortunately, we've also seen some young and very healthy people become very ill and also succumb from the infection. So it doesn't discriminate totally. For some people, even if they after to recover from the acute phase of the illness, even after a mild illness for maybe a week or two, a small percentage of them do end up having lingering symptoms that last from weeks to months. Some of them will have chronic cough, shortness of breath, muscle pain, chest pain, headache, even some memory or concentration issues. We're not quite sure why, but it is real that a small percentage of people who recover will have these symptoms from weeks to months. So getting the vaccine is a safe and effective vaccine up to about 95% effective from getting an infection, will prevent you from all the acute phase illness issues like being hospitalized, but also prevent you from getting those more chronic symptoms that might last for weeks to months.
So what could happen if I didn't get the vaccine? Are those kinds of things that could happen even if I didn't have and didn't end up in the hospital? Could I still have those kinds of long-term lingering effects?
That's right. Even if you have a mild illness, we've seen people who get maybe, just like a bad cold. And after they recover from the bad cold, they still have weeks or months of this sort of concentration problems, fatigue. It's really hard to predict who will get those long-term effects. It doesn't necessarily just mean people who get very, very ill. So if you get the vaccine, then you severely increase your chance of not getting sick and not having those symptoms.
So then how do I know it's safe to actually get this vaccine?
Yes, I mean, this vaccine is very safe because it's gone through scientific trials for months in different countries. And we had, as you probably know, we have multiple different vaccines now. And each country's regulatory agencies, including the ones in Canada, have studied the vaccine to see how it was tested, looked at the results, and it's proven to be a very safe and effective vaccine. We continue to monitor for side effects, other than from the trials, from people getting the vaccine worldwide. And by now we have maybe tens of millions of people who have received the vaccine, and we haven't seen any evidence of any severe side effects, just the usual minor side effects, that one would see, which is like a sore arm for a couple of days, maybe feeling a little tired for a couple of days, maybe a headachy for a day or two.
Mm-hmm. So, but how did they develop the vaccine so quickly? It just seems like it was faster than most other ones. So how did they do that?
Yes, it is true that vaccines usually take a number of years to develop, but this one, it took a year. It's because of the severity of the COVID pandemic. Many governments and vaccine researchers and companies decided to concentrate and prioritize their efforts on developing vaccines. So they pulled all their resources together and stopped doing, other research and development activities on like a new blood pressure medication or other things that were just not as urgent. And this is how we were able to develop a vaccine so quickly. Now, bear in mind, it still went through the usual checks and balances to ensure it's a safe and effective vaccine. It's just that everyone really spent all their efforts to developing a vaccine, and we've been very successful.
So I know that you touched on it just a little bit, but can you explain a little bit more what I can expect post-vaccine for reactions? How long do they last, and what could I typically expect?
So the vaccine sort of reactions or side effects that we have seen for COVID-19 vaccines have been relatively the same as what you would normally get when you get your flu shot or your tetanus shot or your whooping cough shot. Essentially, the most common one is a sore arm, for a day or two where you get injected in the upper arm. And then as your immune system starts to react to the vaccine, starts to make antibodies, gets ready, the antibodies against COVID-19, your body then might feel a little bit fatigued, maybe a little bit of headache, a bit of muscle ache, or maybe even a fever, but this is short-lived. It's usually just for a day or two. It's fairly common, so don't be surprised if you do get it. But it's just your body basically getting itself ready with making antibodies.
So can you tell me, if I do get a reaction from anywhere from a mild one to a more severe one, what should I do?
Right. So you don't have to do anything in particular. If, however, you feel headachy enough or your arm feels painful enough that you want to take something for it, feel free to take some Tylenol or ibuprofen, just like any other aches and pains that you might have. You may need to rest a little more than usual for a day or two after because you've got a bit of a headache or fatigue, but you don't really have to do too much. Just bear in mind that when you get the shot, after you get the shot, and we do monitor you for 15 to 30 minutes, just to make sure that you don't get any of the more rare severe side effects. Things like a severe allergic reaction. If that's going to occur, that will occur in the first number of hours. And rest assured, if it occurs at the vaccine center, we have staff and the medicines to ensure that we take care of that, sort of for a severe allergic reaction or anaphylaxis. And if it occurs in the first few hours while you're at home, if you have severe swelling or shortness of breath, these are all very, very rare. But if you do get to your healthcare center, and they'll know what to do.
So let's say that I got my first dose. What happens if I get COVID before the second dose? Can I still get that second dose?
Yeah, for sure. It'd be awfully unlucky if you get COVID after the first dose. Now, bear in mind, it takes 14 days after your first shot to develop antibodies. And after 14 days, you will have about 90% protection against COVID. So it's excellent protection. If you're unlucky enough to get COVID after that, yes, we would still recommend that you get your second dose so that it will boost your immune system to have a longer and fuller protection for later on.
So, and if I miss that second dose, which I understand is usually happens between 21 and 28 days after the first dose, if I miss that second dose, does that mean I have to start all over again?
No, you don't. Vaccines in general, you don't have to do that. Because what happens is if you miss the second dose, just make sure you try to get it as soon as feasible. And the first dose protection that I talked about will likely last for up to a couple of months before you get, even if you get delayed up to 42 days, for example. Right now, there is a little bit of possibility of delay of the second dose because there's a vaccine supply issue. So if you get delayed, not to worry, you still have good protection. Just try to get your second dose as soon as it's available. And that second dose will afford you the longer protection. And even if you got it late, it will still give you very, very good long-term.
So as I understand it, then that second dose makes my protection last longer.
That's right. That second dose will make your immune system even more aware and make more antibodies against COVID-19 if it ever arrives in your doorstep.
So do we have an understanding yet of how long the vaccine should last once we have that second dose?
You know, since COVID-19 is very new, we don't know for sure. We hope it lasts for a long time, but I think there is a possibility that we may need booster shots like the annual influenza vaccine. As you know, the COVID-19 virus is continuously changing. We have new variants coming. So there is a possibility that we may need to get booster shots every year.
And what about now, like after I've had that second dose, do I still need to take precautions?
Absolutely. You know, when you're driving a car and you're wearing your seatbelt, we still need to take our precautions. We still need to not drive so fast. When it's icy, we need to slow down. So yeah, because the vaccine's not 100% effective. It is around 90 to 95% effective, which is pretty darn effective for a vaccine. It's, you know, obviously a great layer of protection, but we still need to do the things that we've been, you know, that our public health measures, such as wash your hands, you know, wear your mask when you're indoors, stay physically distanced when you can, and when you're ill, stay at home and get tested. So
I'm going to throw in a little bit of a side curl question. So from what I understand, the vaccine will protect me against serious consequences, but that doesn't mean that I can't be a carrier to somebody else at this point. We don't know that for sure. Is that correct? Or is that the reason why we need to take precautions still?
You know, I think there's a couple of things. We still need to take precautions because it's not 100% effective. So we want to get as close to 100% protection as possible. In terms of whether or not you can get infected, not feel very ill, and still pass it on, they never studied that in the initial trials. But we're looking at trials at real life studies now, in particular in countries where they've been able to immunize a lot of people, like in Israel, where about half the population has been immunized. And there is evidence now that there's increasing evidence that if you get immunized, you may not as readily pass it on. So that's a great bonus.
That's good
so
news.
If you get immunized, then you're protecting your family, you're protecting other people who may not be able to be immunized, and other people who may get very, very ill.
Yeah, that's really good news.
Yeah.
That's really good news. So you touched on it again, but if you can just expand a little bit, will this vaccine protect us against the variants? Because we have a bunch of those rolling around now.
That's right. I mean, at this time, it does protect against the most common variant in Ontario. Thankfully, the variant is still quite uncommon. It looks like at this time, like I said, it's going to protect, but there is concern that with time, it may not be as effective against other variants. We're monitoring this very closely. And if it does become less effective, we believe that the vaccines can be changed fairly readily so that it can protect us against those variants. So that's why potentially we may need to have booster shots every year or so.
So who should not get the vaccine? And if you could include in your conversation, if I'm pregnant or if I'm breastfeeding, yeah.
Yeah, so certainly those who are allergic to components of the vaccine should not be getting the vaccine. When they do trials, they often exclude people such as pregnant women and breastfeeding women. And this is no different. So the scientific trials were not done on those who are pregnant or breastfeeding. Having said that, we give lots of different vaccines during pregnancy and they are safe, such as the flu shot, tetanus, and whooping cough. And obstetricians and vaccine experts believe that the COVID vaccine is safe for pregnant and breastfeeding women. More and more pregnant and breastfeeding women are getting the shot. And as time goes on, we are seeing that there are no major, safety issues. But certainly, we believe that pregnant and breastfeeding women would benefit from this vaccine. Also at this time, the vaccine is not being offered to children under 16 years of age. Again, for the same reason, the trials were not done on them. They're being enrolled in studies at this time, just as pregnant women and breastfeeding women as well. And, just like any other vaccines, we fully anticipate that children will be offered the vaccine later in the year, likely in the late summer, or early fall, depending on the studies and the supply. And then lastly, people who are immune compromised because they have a medical condition, such as cancer, or if they are immune compromised because they're taking a medication that depresses their immune system. Again, the studies were not done on them, and it would be a good idea for you to discuss it with your healthcare provider. Having said that, again, with previous vaccines, there hasn't been any harmful effects to their medical conditions. It's just that we just don't know how effective it is. So again, in general, we do recommend that vaccine to those persons who are immune compromised, but again, best to discuss it with your health provider.
Can you just expand a little bit about the immune compromised people? What people would that typically include? Like, what kind of conditions would you be referring to?
Right. So, for people who have cancer, who have immune deficiencies, such as they don't have enough immune globulin, very severe sort of immune compromised conditions where your family doctor or your healthcare provider has said, you got to watch out because you're more susceptible to getting infections. As well as some people who are on chemotherapy or on steroids for their conditions. They're just more susceptible to infection. And those people were not studied, but if you think about it, they are more susceptible to infections, including COVID-19.
Mm-hmm.
It's more the reason to get the COVID-19 vaccine.
Yeah, so discuss it with your healthcare provider.
Exactly.
And just make sure that he's comfortable, she's comfortable, you're comfortable, and then go from there.
That's right, yeah.
Okay. What if I get the vaccine and my family doesn't? And you kind of touched on that before, but let's just go into that deep dive.
Sure. Yeah. I mean, the good news is that, you'll be protected by the vaccine and less likely to get COVID-19 and become very ill from it. The bad news is that your family isn't. But you know what? They can always change your mind later and get the vaccine. It's okay to change your mind and get it later if you're concerned. Ask the right questions to your trusted healthcare providers. But again, better to get it now to be protected early. By protecting yourself and your family, again, there's increasing evidence that you're also protecting the community. Not everyone can get the vaccine because they might be allergic to it. And as more people get immunized, there's just less people that COVID can infect, and the better chance of, getting COVID-19 under control and ending the pandemic.
What if I already had COVID though, and I've recovered? Should I still get the vaccine?
That's a good question. After you recover from COVID-19 infection, you probably have at least 3 months of protection against other COVID infections because your body has mounted an immune response, such as some antibodies. However, I would still recommend getting the vaccine because I know there's a fair chance that it might boost your immune system even more and provide additional protection. The bottom line is we don't think there is any harm in getting the vaccine, but there's only the possibility of benefit. So I would certainly recommend once you've recovered and feeling well.
So I just have one last question for you. We've heard about this thing called COVAX, and can you tell me a little bit of what that actually is and what I'm agreeing to?
Sure. So COVAX is a provincial electronic documentation system for vaccines, in particular for COVID-19 vaccine. It's a tool that the province is using to track how much vaccine is in different places, and also who's getting the vaccine, when they're getting it, and then when they're also due for their second shot. It also allows us to know how much a community is being covered by vaccine, so it allows us to plan. If the community is not as well covered, then we can bring more vaccine to that community. Rest assured that the COVAX system follows all privacy, health information, personal health information, legislation to ensure the confidentiality of every client. Your birth date, your address, it's not going to be shared with any. It's just they use the data in order to allow for planning. Also, for the benefit of each person, is that if you ever need a record of the vaccine, we can retrieve it from the COVAX system.
Who would have access to that information?
Certainly, the people who are immunizing, when they are immunizing, will have access to that system. But other than that, the public generally will not have access to that kind of granular information.
Well, Dr. Lee, thank you so much for providing all this information and giving your time to us. This was really helpful for me, even as an immunizer. So just thank you for joining us. And I know that you've answered a lot of questions that our community has. So we'll see you soon, and stay well.
Yes, we're looking forward to coming. And you know what? There's no stupid questions. There's no bad question. So feel free to ask us. Obviously, ask your trusted knowledge keepers and healthcare providers. And we're really looking forward to providing the vaccine and ending this pandemic very, very soon.
Thank you very much.
Bye now.
Bye.